February is almost here, and that means Heart Health Month. There are some simple steps to take to help ensure that your heart stays strong. Dr. Stacy Chronister is an internal medicine specialist with OSU Medicine. She's here to give us some 7 steps, I guess, to a healthier heart.
Absolutely.
Our heart is extremely important.
It's extremely important, and that's what keeps us going. I mean, really. So really, when it comes to heart health, not only is it things that you can be doing down the line after you already know you have heart disease, but what can you be doing right now to prevent it from ever happening?
So what I want to do is I want to start with the full 7-step list to have healthier heart, and giving you a chance at home to be thinking about, okay, well, check the boxes as we go. We'll just run through it quickly, and then we'll go line by line.
First off, we want to stop smoking or using tobacco. We need to add exercise into our life. Healthy diet. We want to maintain our weight, certainly avoid adding any additional weight. Get quality sleep. We need to control our blood pressure, and we need to be screened for diabetes and high cholesterol.
Now, I think by now most people are aware of the dangers of tobacco, and that's all forms of tobacco.
Absolutely, yes. All forms of tobacco. If you are struggling with that addiction, it is very difficult to break. Please reach out to a physician. We have ways to help if you haven't been successful before, to try to get you to get off of the tobacco.
All right, the exercise. Now, a lot of people say, you know, how much is enough? Because we've heard the gamut. Like, I just need a little bit a day, and then other people say, no, it's got to be full-on cardio.
Absolutely. So for heart health, what we know is that 150 minutes a week, okay? That averages out to 30 minutes over the Monday through Friday. So 5 days a week, 30 minutes. But really, when we talk about it, that's hard to do. It's hard for a lot of people, especially if it's not already in your life, to stop and say, now I'm going to dedicate 30 minutes to this. So the good news is that we can add it all together.
Right.
So it can be 10 minutes here, it can even be 5 minutes. And really, it's even those people that keep moving throughout the day that actually have even better heart health.
You've talked about fidgeting.
Fidgeting, I know. That person who, kind of like tapping their foot, tapping their fingers. You are increasing your activity, you're using your muscles, and those patients actually have lower heart health, or better heart health.
So when Alan is drumming over there, that's a good thing. Okay, I'll try to back off of that. Heart healthy diet, what are we trying to include?
There's a lot of different things that we can look at, and of course we want to eat fresh as much as we can. A great way to look at that is to look at our salt content. So let's keep our salt content under 2 grams a day. That comes from things that have bags, boxes, cans, are going to be a lot higher in sodium. Sodium increases our blood pressure, and so if we can avoid the foods that are high in sodium, we're probably eating a healthier diet, and we're helping out our blood pressure too. The nice thing is that actually bananas or foods that are higher in potassium can lower your blood pressure, so absolutely grab something that's a little bit higher in potassium.
This goes hand in hand with watching our weight and knowing what is kind of that range where we need to be in.
Yeah, and the fact that we're asking you to move a little bit more, eat less salt, eat a little bit healthier, will naturally play in the role with you losing a little bit of weight or holding our weight maintenance, because that has a lot to do with our heart health.
Earlier we talked about sleep in the story. I mean, it
was like a perfect setup, really.
Right?
Yes.
How much should we be getting?
So we need to be getting at least 6 to 8 hours. Now, as you age, sleep becomes a little bit different. You don't need nearly as much, but you might find yourself kind of catnapping throughout the day. That's perfect if you only get about 4 or 5 hours, but if you can get that nap during the day, that will be very helpful. Avoiding alcohol is a really big key, and caffeine before you go to bed. And if you find yourself snoring, get it checked out, talk to a doctor about
Go to one of those sleep study places. For sure. Okay, blood pressure and knowing our numbers.
Yeah, so what we really want is that systolic blood pressure, that upper number to be less than 130 and the lower number to be less than 80. So if we can keep those numbers low, that helps out the back of our eyes, our kidneys, our brains, our heart, from having to work so hard and from getting damage from those high blood pressures.
So we talk about diabetes, cholesterol, those are kinds of the things that can be, culprits down the road.
Yes, in addition to having high blood pressure and our weight, the biggest things that we can look for is diabetes and high cholesterol, because that is what is contributing to bad heart health. The cholesterol embeds itself into the vessels of the heart, and that is where we get a lot of the plaques and the hardening of our heart. So if we can keep our cholesterol lower, all the better.
Just about genetics, how does that play a part in our heart?
Actually, a really big role. Yeah, so if you know that you have somebody in your family with heart disease, you are more at risk as well. So easier to get checked out much earlier, especially anyone under the age of 50 in your family who's had a heart attack or stroke. That is a much higher risk than someone who's had maybe heart attack or stroke in your family at upper ages 70, 80.
Very good. All right, so get out your red. Be ready for February. It is the month of love, and you want to take all the best care of your heart.
Absolutely.
Great to see you. Thanks for coming in, Dr. Chronister.